Welcome to Functional Medicine 2.0. So happy you're here. I'm Dr. Z, and with me today is family nurse practitioner Lorri. Hi, Lorri. Thanks for being here.
Hi, Z. Thanks so much for having me.
Yeah. So our topic for today is if you need 12 labs to make a decision, you're avoiding clinical thinking. And that sounds a little harsh. I mean, we love labs, right? We
Mm-hmm.
love labs. So this is not anti-lab. They're super powerful tools, but labs are not a replacement for clinical judgment.
Exactly.
And it's so important they understand this. I think it's a common mistake. I don't know. Tell me what your experience is. Lori, I know you train a ton of practitioners,
Mm-hmm.
and you've worked so long in, traditional healthcare yourself, having your own private practice. Um, but I think a lot of practitioners in the beginning, because they're stepping into something new, even if they have decades of experience in traditional medicine, this might be the first time they're doing functional medicine, really looking at, pathways in the body, the person as a whole. And they're coming out of a system where everything just had protocols, told you exactly what to do. There was a CPT code that led to ordering a lab, right? And it just connected all the dots for you. And I think sometimes in the beginning, it's like, well, I have to order every single lab there is.
Right, particularly if you're taking into account you were trained, right? And well, you learned in your functional medicine training that listening to the patient was super important. So if you have a patient who comes in and has all these symptoms, right? They've got stomach, they're bloated, they're sweating, they're gaining weight, that it's just across multiple systems that you're seeing these symptoms. That knee-jerk response might be to, okay, now I'm just going to order all the labs. I'm going to order a gut test, a hormone test, a serum test, and oats. Let's do some toxins as well, and let's see everything, right? Yeah. And then where do you go? Where do you start?
I know there was a time where I did that too.
I can say I've done that, yes.
Yeah, so full disclosure for sure, and that's part of how I learned, some of the teachings from FM 1.0 that weren't working. Because the thing that I found was that there was just too long of a gap between, bringing that patient in, getting all the labs, waiting for them to come back, the super long, report of findings. They'd feel overwhelmed. We were talking 3 to 7 weeks before something happened. And that doesn't help the patient. It's bad for business. And it's putting all this like cost up front versus there's so many things that you can help the patient on along the way so they can start seeing wins. And I'll give you one example, because I would see SIBO patients a lot. It was something I dealt with, became an early expert in, would get interviewed on, all these things, vetted doctors for like the biggest SIBO support group out there. And so I had a lot of SIBO patients. And so in the beginning, it was like, okay, we just always get SIBO breath tests and all these other tests. And
Yeah.
sometimes that's nice to have. However, what I learned over time was, well, wait, sometimes we're testing and we don't need to, and the patient has to pay for that. They might not even really have SIBO or not, or maybe we can make some progress elsewhere, triage the order of when we're supposed to be working on this. Sometimes it was a financial decision, but there were things that I could get the patient to do, clinical care things. Like maybe we would try the like low FODMAP diet. We could do low FODMAP diet for a couple weeks, see if that even made any difference in their presentation. That didn't need to cost them any money. And then maybe I'd have them try some probiotics or something right before the next visit. So we're doing all this like in a 2-week time span. Did they feel better? Did they feel worse? Did they feel the same? And based on that clinical data and everything else that was going on, we would decide, well, we can order that breath test now.
Exactly. I've had this discussion with patients before coming in wanting to look at, say, hormones. Hormones was my jam. I love hormones, women's health and women's hormones. And, I'd have women come in that perimenopausal sticky place where just nothing's working. Everything that they've done before to keep their body healthy and feel well isn't working. And they want to know what their hormones are doing. And the first thing I would do is order a Dutch test and look at their hormones and see, yeah, you've got low progesterone, and maybe start to work on that. But what I missed in that was this person is intermittent fasting. They're not fueling their body. Their body doesn't feel safe. There's simple low-hanging fruit there that I skipped right past, right? And if I had stopped, really looked at those types of things, instituted those small changes to the person while we're waiting for a test to return if that's appropriate, they're going to start to see improvement before we even do a review of findings, because you're starting
100%.
to work on just even those habits and lifestyle and behaviors that are driving the illness.
I love that. I think that's so, so important. And that's really part of what we're trying to say. Like FM 1.0 conditioning was, more data equals better care. Certainty comes from completeness, defensive medicine disguised as thoroughness, and it makes practitioners hesitate. And what it looks like in practice is massive panels ordered up front, the weeks of waiting before acting, patients paying thousands on labs before any momentum starts, and then the clinicians spend all their time interpreting versus like leading. And then data piles up and direction disappears. So that's the other thing I've seen is that practitioners will get overwhelmed. And they're like, I now see everything that's going on. We have 18 months worth of work to do. What am I going to do with this patient? And sometimes they just like, spit it out all over them. And the patient's like, oh, I'm out of here. This is overwhelming.
Right? The patients can lose confidence, and then it becomes this negative feedback loop to the practitioner that, oh, look, I'm doing all this stuff and the patients still aren't getting the outcomes that they need. Maybe I need to try harder and test more.
Yes, exactly. And, we should talk about the business side for a second because this affects operations. It puts a huge burden too on the practitioners, on the staff, that you're supposed to figure out everything up front when the patient, for the most part, usually isn't even looking for all that. Like they come in with one complaint that needs to be addressed. And then, of course, we want to work with the whole body and everything that's going on. But, after years and thousands of patients' visits doing it that way, I found it worked so much better. And I could actually compress care into a shorter time frame, would cost the patient less. Right? They actually paid more up front, but I got their buy-in to do this work and they paid less than they would have over time. But we're all on the same page. And what I would do is I would treat that initial period of care, 3 months, 4 months, 5 months, whatever it was, that's like our intensive time period. And I saw the whole thing as an intake, an ongoing exam, and pulling back layers and getting to know more of them. And same with labs. Like instead of doing them all at once, I would do them strategically as they were needed. And I found the patients liked it better. They didn't feel so overwhelmed. And if they're paying for labs out of pocket, it wasn't all at one time, right? And then we could actually work on, data that came back. And sometimes like a lab I was going to order up front, later on, I didn't need it.
Yeah, right. There's no need to do all the tests all the time for everybody. It really should be that personalized medicine for the person in front of you. So getting away from that protocol type, that care that we were trained on in traditional medicine and even functional medicine 1.0, a lot of people kind of wanted to just force that way of practicing into functional medicine, and it does a disservice both to the practitioner and the patient. As a practitioner, if you do all those things at once, just think, I know I've had to manage this, all the messages coming in through your EMR because your patient now is having all these side effects, they don't understand what's going on, it's too hard, they feel like a failure, right? And with human behavior, we want to get those small wins in first for the patient to actually buy in and gain trust with you. So pushing it too hard, too fast with all these tests is the antithesis truly of what we should be doing.
100%. I totally agree. And I love what you said that, we brought a lot of the training from traditional medicine into functional medicine 1.0. So it's like, okay, if we're not using a pill for every ill, a prescription for everything, but now we're throwing a supplement protocol at it. And we want to do whole body healing. And we were just doing CPT codes there, but now we're going to tell you everything that's going on. And here's the protocol for full body, change. And oh gosh. Yeah. Been there, done that. I've seen it so many times.
Right. And testing downstream stuff, right? You really want to get to that, or testing upstream, really. You want to test you want to figure out what that that identifying issue is, that their main complaint is, and work there first. Get that ground stable, get the body safe, get the person feeling well, and then move forward.
100%. I think I mentioned this before, but I used to always do deep dive gut protocols. It was like really what I started in, and I loved it. And for me, I know everyone has a different approach, but for me, in my experience, I really learned later to like work on that immediate complaint they were coming in with that was just good as far as like a business owner, and I have a customer in front of me, right? Like, and sometimes, it was like a huge long list of serious stuff, but dry eyes was what they cared about the most, or a huge long list of really serious stuff, but weight loss is what they cared about the most. So being very aware of that. But also I just found like getting some palliative relief, getting little wins, sort of building them up, building the relationship, the trust in themselves, their body, me, then they'd be ready to tackle the big thing. Otherwise, sometimes it was just too much too early.
Yeah, I think back to one woman that I worked with, a lovely patient that I'd known for a while, and we did a Candida questionnaire and a GI map on her, and sure enough, she had Candida questionnaire lit up, and her GI map actually showed Candida. So we knew this was a lot for her. I put her on a full-blown anti-Candida elimination diet, and the poor woman developed the rash that you get that's incredibly itchy from the detoxification of everything, everything dying off, not detox, but the die off of everything in the skin. And I was like, well, just keep doing it. It means it's working, right? And 2 weeks into it, she's like, Lorri, I just can't keep doing this. I'm miserable. I'm like, okay, I get it. Let me reframe this. This is too much, too soon, too hard. Your body's saying it,
Yeah.
and you're telling me too.
100%. When I would deal with yeast overgrowth, I actually had 3 different plans. Same issue, but what was the person up for? What could they handle, So some of these lessons we learn the hard way, but if we can learn them faster and help others, they're going to be in such a better situation. And just like we say, to trust the patient and believe them, even if it doesn't make sense right away, believe them with their symptoms. They're having an experience and we have to figure out what's going on. Same thing with how the body responds. And
Yeah.
I've met practitioners and trainers out there who are like, if the body's not freaking out, you're not doing anything. And I was like, no, that's too much. And that's bad for business. No one wants that. You don't want to develop a reputation that going to functional medicine means you're going to have to live 14 hours in the bathroom or call in sick at work for 2 weeks. How's that going to work?
Right. And that was me coming in with the belief or the understanding that trying harder meant you were going to get a better result too. And that is not the truth. That is not the truth.
So important. And the uncomfortable truth is most cases need a first move, not a full map. And you and I know we were both trained in functional medicine 1.0, and it was like, let's spend 10 to 20 hours dialing down a case, getting a full map. It's multi-generational genealogy and history.
Yeah, tell me about your birth history, all the things. And yeah,
I might need to talk to your mom. Is your grandma still in the picture? Let's do interviews. And so waiting for certainty is still a decision, right? Like we have to know how to move forward to help that person. So it goes right to the reframe, functional medicine 2.0, rule number 1, decision making, right? Not just data, but decision making. Stop training biochemistry librarians, start training clinicians who actually help people. And it doesn't mean you don't test. We love tests, right? But you need to know the timing for it, when, make sure that labs, the lab results that you anticipate, it's going to have an impact on clinical care. Right. So I remember I've altered the name, but I think you know who I'm talking about. But Dr. Sarah, who she was trained in FM 1.0, ordered 10 to 12 labs per patient. And that made her feel safe. But she was also freaking overwhelmed because some of those labs might have 50 or even 120 markers on it. Right. And she's ordering so many. And then she switched to starter visits. Like, let me meet the patient where I am. Let me start, where are they at? Like, let's use decision frameworks. And then she started using which lab should I order, the tool we created. So that's super helpful. and ordering only labs that changed clinical direction, created action. And she started getting faster clarity, calmer patients. She was less freaked out. It was less operational stress for her office. So I think you and I both went through that experience, and then being able to teach other people, super helpful. Another one is nurse practitioner Mike. Afraid to act with complete data, coming out of traditional hospital care. Patients were stalled, waiting weeks. And so honestly, like, the compliance went down. People started ghosting the follow-up visits. They started feeling grumpy and second guessing, what am I investing for? All I did was get all these labs done. I don't have answers yet. Too much time was going on. And so he began testing like low risk, high impact moves. And then the labs were layered in, sort of what we were talking about. And he saw better follow through and confidence. Are you seeing this too? I know you're working with practitioners every day.
Yes, this is something we talk about regularly in our classes that we support our clinicians, and reframing this. Being decisive about where you're going and what you're ordering is not being careless. It doesn't mean that you won't eventually potentially get to that place where you're doing a total tox burden or something, right? Because of their exposure. But you have to address that. You got to support the body and support the patient in the way that the systems that the body responds to, in a stepwise approach. So going in and throwing everything at it, like, throwing spaghetti at the wall, is just going to leave a big mess, rather than giving one bite at a time. We're going to do this next. We're going to do this next. So just being decisive and not careless.
Are you seeing some deal breakers that, practitioners miss? We have to train them in that, some small issues, or really initial, like how to triage, and people are sort of messing up the order until they learn the right way?
Yes, this is honestly one of the biggest things that we educate our practitioners on, is where to start. We need to get the body safe first in order for it to start moving forward. So going after those foundational lifestyle things, which, fueling appropriately, if everyone's on the intermittent fasting and keto train and eat less, move more, right? And they're just depleting themselves, getting further away from their health goals, trying harder and not understanding. So helping the practitioners who've also live in this society where we thought eat less, move more, try harder, is
one more spin class will be the solution.
Right? That's going to get you there. That no, actually step back. You as the practitioner need to provide that safe space for the patient to stop, relax, regroup. Okay, now let's start fueling the body in the right way. Let's start sleeping. Let's start moving. Let's start hydrating. Let's manage our stress. And I know that might not be the fancy tests and the things that we as little Nancy Drew detectives might enjoy so much, but that's really what's going to set the foundation for the patient then to actually make the changes that you might need to see when you do testing. So working on those foundations first. And that's why, like you said, this is where making those decisions right away can really be so beneficial to your patient, because you have them. Say you have a patient come in who's intermittent fasting, is doing one meal a day, right? And they're that perimenopausal woman. They've got those 20, 30 pounds they just can't lose. They're sleeping not great. They're waking up with night sweats, or maybe even some anxiety. And if you have them start eating and fueling and giving the body actually what it needs to feel safe, you can actually, for a lot of these people, move the needle enough that, you get an 80, I'd say, honestly, patients probably will get an 80% improvement in symptoms if they just work on the foundations. And then the
100%.
testing is like the frosting on top of the cake, right? Cake is all those foundational things. And then to make it look pretty and really make it exactly the way that they want, that's where the testing comes in, and then the fine tuning.
I love it. We have a website a webinar that we do for our practitioners. We make the slides, we demo it, they can do it for their patients, and it's called Sleep Your Way to Skinny. Because sometimes just working on sleep, you can see a 5 to 10 pound shift. And that might be the best thing to do without worrying about changing anything else yet. So I
Yeah.
love that. And I love what you were saying too. You know, what popped into my head, Lori, is, you know, some practitioners, I think, might be a little addicted to the puzzle and like solving the mystery, the medical mystery. It is fun, right? But that's not always what the patient in front of you needs.
Right. And you might be really good at it too. And it gives you a little bit of a place to not necessarily toot your own horn, but to present to your patient, like, look, these are all the things that are going on in your body right now that we need to address. And I figured it out and we're going to fix you.
Yeah, it could be a
Right.
dopamine hit.
Yes, as the practitioner, right? But then you get that, like I talked about earlier, you can get that negative reinforcement if you push it so hard, then the patient's coming back saying, hey, I'm having all these symptoms. This is really getting worse instead of better. I'm not liking this, you know? And
Yeah.
then if you're like, well, I knew what was wrong. Why are you
Yeah.
not
Yeah. Why aren't you
doing this the right
succeeding?
way?
I gave you
Yeah.
the perfect answer with a bow tied. I went all the way down to genetics and methylation and, you know, the third enzyme in a hormone cascade. What's wrong with you?
I gave you the answer, right?
Yes, I gave you the
But that's
answer.
not our job. Our
No, it's
job is to walk with the patient through the journey to help them know how to, or teach them how to make these small changes
right.
in their habits and behaviors that are lasting, that will bring them to those health goals.
And I've had some practitioners, they really love the answer part, and I get it. I love that part too. But
Mhm.
they're so hooked on the medical mystery, then it's like, well, let's look at who you are then. Because if that's what you really want to do, maybe we want to set up your practice that you have health coaches, maybe some mid-level practitioners, and they're doing the visits and orchestrating the plan with your patient. And maybe you just do like the high-end, more complex cases, or you be the lead strategist. Like, let's put you then in the position you want. You want to go down that rabbit hole. Great, but you need support for the people who are coming in and to set the foundation. So if they find that's really them, great. Build the business that's going to model that, but don't think that behavior is going to serve the vast majority of people coming in. It's not going to get them to the point they want, right?
Yeah, and honestly, I think the majority of practitioners who are coming into functional medicine from traditional medicine would benefit from bringing in a health coach because and I'm speaking from my point of view, this is me, I am that person. I love the data. I get annoyed if I have to tell someone more than once to do something, right? It ends up feeling like you're parenting someone. And if that's not where you can bring your best self to help that person, bringing on a health coach who loves to support a patient through that journey and can do it in a way that the patient really enjoys and
Yeah.
wants to do it
Feel
is.
supported, held,
Mhm.
loved. I remember the first time I started teaching my patients in groups was after I said, if I say this health plan one more time, this meal plan, right? If I say this meal plan one more time and describe it, I'm going to pull my hair out.
Right? Aside of like maybe making a few videos and posting them in your EMR or something for people to review,
Right.
that does not give you the hands-on personal approach that a health coach does. A health coach, in my
100%.
opinion, is one of the most robust things that you can do for your practice, really, to
Yes.
bring someone in to
Most
help you
important,
scale.
least celebrated, right?
Yes, it's just kind of brushed over, and how do I do that? And it's gonna be too expensive and it's too much, and how am I gonna manage that person and all the things, right?
Yeah.
It can be challenging for the practitioner to figure that out.
We have great solutions for that, though. You should mess with
So,
us. I know it's not our topic for today, but we've been there and done it. We've done every way. We've found the ways that don't work and the ones that do.
yeah.
But yeah, the bottom line is no matter what type of practitioner you are and what you love doing, like we need to build a practice that supports you in what you love doing, but you have to understand you're serving the public. So whether it's you holding their hand and designing or orchestrating that, what it takes to biohack human behavior, or you have someone on your staff doing it, you just have to do it, right? Like it has to happen in some way, shape, or form for them to get those results. And, we were starting to talk a little bit about pathways. I mean, are there things like being anemic or blood sugar or dehydration? Are there things you're seeing over and over again that people skip early on, or maybe just not even understanding the pathways, and then they're
Yeah, I
relying on
mean,
labs?
a simple reading of a CBC and a CMP, a true reading of that can give you so much insight as to what's going on rather than jumping to much more expensive in-depth tests so you can really see what's going on with their nutrition. Is there some inflammation there? Are they anemic? Like looking at those simple tests first.
And so much clinical wisdom you have to share. All these, like, I know you put a lot of it in Lab DX, which is phenomenal, but there's so much stuff out there that you won't see like in a typical textbook or a typical course situation, that it's like, oh, if you see this or hear this, you have to know, don't go there yet. Like, go here instead. I mean, I think that stuff's so important. And to not have to learn that all from trial and error. You could do a better job right up front with your patients by knowing, like, oh, when you see this marker or you hear the patient say this, intermittent fasting's out. You have to go in this other direction instead, right? I love it. Okay, so then when you understand that, labs can become more strategic and not defensive. I was thinking of a physician assistant, Jess, you know who I'm talking about, where they were over testing to avoid missing something. They had been in ER forever, but then being able to build a decision hierarchy, learning how the body works, which is really what functional medicine is supposed to be about, right? What are these pathways? How does the body communicate? And, what does, like, so much knowledge that patient brings to the table just by telling you what's going on, especially if you know the right questions to ask.
That's actually one of my favorite things about first seeing a patient is that initial intake and hearing their story, because I truly believe that they are telling you exactly what's going on. And you just have to sit back and listen, put those pieces together, recognize those patterns, what dysfunction might be going on in their own behavior that might be driving some of their symptoms, in addition to, this sounds like, there's legitimately, you've got vertigo. There's legitimately something going on here. But where is it starting from? So, yeah.
I love it. Well, you listeners, you're hearing it from two practitioners who are trained in FM 1.0 and are living FM 2.0. It's a scalable practice is built on clinical intelligence, right? Not heroic analysis. And we love labs. We build lab tools. We write lab textbooks. We're in it day to day. We love them. But it's about being decisive, knowing when to triage them, right? When to wait till later. It's not about being reckless, right? So FM 1.0 trained you to fear being wrong, and FM 2.0 trains you to move responsibly. So you don't always need more labs. You need clear thinking. What's the priority? How do we triage it? What are the little steps? So make sure, everyone, you're not hiding behind one more test. Don't outsource your confidence to data. You want to lead with judgment, and you use the labs to refine, not delay care. So I want to thank you, Lorri, for being here today. Thank the listeners. This is Functional Medicine 2.0. Labs still matter, but being a decisive clinician with leadership matters the most. So if you need 12 labs to move, the problem isn't complexity, it's hesitation. All right, we'll see you next time.